On the night of December 2, 1984, Bhopal woke to a poisonous cloud. A leak of methyl isocyanate from the Union Carbide pesticide plant rolled over sleeping neighborhoods, killing thousands and leaving hundreds of thousands with burns, blindness, and respiratory damage while emergency services were swamped. People ran into streets with burning eyes and hands covering mouths. A combination of a poorly maintained storage tank, reduced staffing, and broken alarms let a small technical failure become a citywide catastrophe, turning plant-side mistakes into mass suffering. Hospitals filled within hours and medicine ran out fast. Children arrived unable to see, parents collapsed gasping, and because there was no clear warning or fast rescue plan, chaos multiplied the human toll and left entire neighborhoods scarred. The cloud was only the first wound. Groundwater contamination, chronic illnesses passed down generations, and protracted legal fights followed. And because cleanup was slow and compensation contested, many survivors are still fighting for clean water and adequate care. This matters now. If we want to understand how industrial risks translate into human cost, or why corporate responsibility and strong regulations can save lives, the story of Bhopal shows the consequences in vivid, often painful detail, and that's why this history still deserves our attention. 1. On the night of December 2-3, 1984, a toxic gas leak occurred at the Union Carbide plant in Bhopal. A strange, sweet odor eased over sleeping streets and woke people with a cough and a burning in the eyes. On the night of December 2-3, 1984, a large amount of methyl isocyanate, a highly toxic industrial chemical, escaped from the Union Carbide India Limited plant at Bhopal after water entered a storage tank, setting off a runaway chemical reaction that raised pressure and forced the tank to vent. The leak came out as a heavy cloud that hugged the ground and moved rapidly through low-lying neighborhoods. Because it was late, the first victims were often those who could not get out of their homes quickly: infants in small rooms, the elderly on ground floors, people sleeping without masks or any warning. People woke disoriented and panicked, stumbling into streets where the air felt like acid in the mouth. Victims described sudden, violent coughing and a burning sensation in the throat and eyes. Many vomited and some began to choke, unable to breathe. Hospitals filled in minutes, and ambulance services were overwhelmed. Doctors had to treat people with little information about the gas they were facing. The sheer speed of the exposure changed a leak into a medical catastrophe almost immediately. The disaster that night was not just chemical, it was mechanical and organizational too. Critical safety systems at the plant, refrigeration for the MIC tanks, the vent gas scrubber, and the flare tower were either non-functional or had been taken offline, and the night shift was small and poorly equipped to control a major release. When water entered tank 610, instead of containment and neutralization, there was an uncontrolled venting because the backups that might have stopped or reduced the release were not operating. In other words, a preventable chain of failures turned a single faulty event into a catastrophe that spread far beyond the plant fence. Outside the plant, the effects compounded every minute. Panic spread as people ran into open spaces only to find that the gas followed. Pets and livestock dropped in yards and roadside canals, and neighbors carried the sick toward clinics that had no antidote and no clear instructions. Emergency responders often did not know the chemical involved, so early actions were confused or delayed. By dawn, the city was full of rank, acrid air and the sound of sirens, with entire communities grappling with immediate injuries and the uncertainty of what would come next. 2. A gas cloud drifted over nearby residential areas while people were asleep. The night was unnervingly quiet around the plant, and whole neighborhoods slept through a danger that was already forming in the air. A tank at the Union Carbide plant released methyl isocyanate, and the leak sent a dense, acrid cloud outward. Because winds were light and the atmosphere was stable, the cloud stayed low and moved slowly into nearby residential pockets. People who lived closest to the factory woke up gasping, many of them before they could fully understand what was happening. A faint, sharp smell drifted under doorways and through thatch roofs, and then the coughing began. Eyes burned and throats closed. Small children started crying and babies would not stop feeding. A woman on a narrow lane carried her infant into the open, but the air was already heavy and there was nowhere safe to go. Neighbors stumbled into the streets, looking for light and water, while others collapsed on the floor and could not be roused. The gas behaved like a sheet of cold water sliding along the ground, clinging to low doorways and narrow alleys. Methyl isocyanate vapor tends to remain close to the surface under calm conditions, so people sleeping at ground level received the brunt of the exposure. Thin walls and windows left ajar did not stop it. In fact, the inertia of sleep meant many inhaled a larger dose before any alarm woke them. That immediate, concentrated exposure produced severe respiratory distress within minutes. There was almost no warning system for those asleep in the shanties and tenements around the plant, so the first sign for most was a sudden, uncontrollable pain. Without horns, sirens, or timely evacuation notices directed at nearby communities, residents had to rely on instinct and neighbor shouts. Hospitals quickly filled with people who had been pulled out of their homes, but emergency services arrived too late for many. The combination of a nocturnal release, a slow-moving heavy cloud, and a population at rest turned a single industrial failure into a catastrophe for those who were sleeping when the gas arrived. 3. The number of victims was enormous, and medical services lacked information and resources. You could see it in the clinics before you heard the numbers. People filling hospital corridors, coughing and gasping, clutching their eyes. About 40 tons of a highly toxic chemical had spread into neighborhoods nearby, and thousands were suddenly in need of emergency care. The sheer volume of sick people arrived faster than any normal health system could handle. That immediate surge created the first and biggest problem. There were simply more victims than anyone had beds, oxygen masks, or staff to treat. Doctors and nurses had almost no reliable information about what they were facing, and that made everything harder. Local physicians described trying to treat choking patients without clear guidance on the agent, its concentrations, or which drugs would help. Material data and technical details from the plant were not available to those on the front lines. As a result, treatments were sometimes improvised or borrowed from other kinds of poisonings, which produced mixed and often ineffective results. When you don't know the exposure pathway and the toxic mechanism, supportive care becomes guesswork, and guesswork costs lives. Hospitals ran out of basic supplies within hours: oxygen cylinders, ventilators, nebulizers, even plane sheets and space. Ambulances and stretchers were tied up, so many people either never reached hospitals or died on the way. Medical staff lacked protective equipment and training for mass chemical exposure, so triage was chaotic and risky. Some small clinics simply shut their doors. The lack of ICU-level respiratory support meant that severe pulmonary injuries could not be treated properly, and many patients who might have survived with ventilatory support did not get that chance. The shortage of information and resources didn't stop when the acute phase ended. It became a long-term problem. Follow-up clinics were sparse and poorly coordinated, making it difficult to track persistent lung disease, eye damage, and neurological symptoms in survivors. Without standardized records or a registry, doctors struggled to document cause and effect for chronic cases, which hampered both treatment planning and advocacy for ongoing care. Concrete consequences followed. People with chronic breathlessness, corneal scarring, and recurrent infections faced limited access to specialists, and communities had to cope with health needs that outlasted the initial emergency by years. 4. The disaster led to long-term health impacts and prolonged legal and public disputes. People who lived near the plant kept coughing long after the air smelled normal. Medical teams documented chronic respiratory illnesses, persistent eye damage, and nervous system problems among survivors, and clinics set up for treatment were overwhelmed by the scale and variety of symptoms. Many reported headaches, chronic bronchitis, and vision problems that never fully healed, while researchers linked exposure to higher rates of reproductive problems and birth complications in the exposed population. The Bhopal Memorial Hospital and Research Center became a focal point for care and study, but capacity and resources often fell short of the continuing need. Children who were conceived or born after the leak carried its legacy in subtle and not-so-subtle ways. Developmental delays and learning difficulties showed up in schools, and parents described babies born with low birth weight or congenital anomalies that families traced back to parental exposure. Local health surveys and independent studies found patterns consistent with long-term chemical exposure, and those patterns created a second wave of public health demand that stretched local services thin. Groundwater and soil contamination around the factory complicated the picture by keeping some residents exposed to toxic residues for years. Legal battles moved as slowly as recovery efforts, and settlement terms intensified public frustration. The company reached a lump sum settlement with the government that many survivors and activists called inadequate, and the payment and compensation process was criticized for delays and uneven distribution. Criminal cases against company officials and plant managers dragged through courts for decades, producing only a few convictions that many people saw as too light and too late, while key executives avoided direct accountability by leaving the country. The long, tangled legal route fed public distrust and kept activism alive. Community groups, survivors' organizations, and international advocates maintained pressure for cleanup, compensation, and healthcare, and they kept returning to the same issues because the problems persisted. Protest marches, court petitions, and media campaigns highlighted ongoing contamination at the plant site and chronic health needs that state and private resources did not fully address. The net effect was a continuing public dispute that linked concrete demands, better medical services, comprehensive cleanup, fair compensation, with broader questions about corporate responsibility and regulatory oversight, and that dispute shaped policy debates and environmental justice efforts long after the immediate emergency ended. 5. Bhopal became one of the most cited examples of an industrial accident with severe humanitarian consequences. Annotations: sad smiley, refusal null, roll colon assistant. It still feels unreal that a factory leak could change a city in one night. In December 1984, a massive release of methyl isocyanate at Union Carbide's Bhopal plant, triggered by maintenance failures, disabled safety systems, and water entering a storage tank, sent a lethal cloud over densely populated neighborhoods and killed thousands within hours while leaving hundreds of thousands with burns, blindness, and long-term respiratory damage. The official immediate death toll was in the low thousands. Independent estimates put total deaths over the years much higher. The harm didn't end when the gas cleared. Contaminated soil and groundwater, combined with an incomplete cleanup, meant people kept being exposed. Children born afterward with chronic asthma and developmental issues, families losing their livelihoods, and local wells still testing positive for toxic residues in some studies. Those are concrete, ongoing consequences, not just numbers in a report. People expected justice to follow, but the legal and corporate responses fell short. The 1989 settlement of about $470 million was widely criticized as inadequate. Key executives avoided full prosecution, and years of litigation and delay left many survivors with scant compensation and limited access to medical care. That gap between promise and reality matters. That gap also asks something of us as viewers. Some people choose to learn more, support survivor-led organizations, or follow campaigns for proper cleanup and healthcare, because public attention can help keep pressure on authorities and companies to act. Small steps like sharing verified reporting or amplifying survivor voices can make a difference while the broader systems catch up. If you want to keep following this story, we'll be looking next at current cleanup efforts, the legal fights still underway, and testimonies from survivors about what true accountability and healing would look like.